Hello, everyone. Welcome to another special webinar. This time we have floating pulses, and we start with the first one. It is also called superficial pulse or fumai. There are actually 6 types of floating pulses. No? So the first one is floating pulse. The next one is surging. Third is soggy, scattered, hollow, and drum skin. So these are all floating pulses. So we start with the first of the 6. Okay, a floating pulse means the pulse is accessible using light pressure. Okay, so it's so easy to feel right away. You use only light pressure and you can feel it. It feels weak with heavy pressure. So when you make the pressure uh, deeper, when you press deeper, the pulse will feel weak. And this indicates exterior patterns and deficiency patterns. A floating pulse is described as bobbing, downy, or at the surface. It is due to the pathogen struggling with the healthy qi or the jiang qi on the exterior. So there's really a fight going on. No? So that means the patient still has the capability to eliminate the pathogenic qi. And vessel qi acting on the exterior surface. It is also found in a deficient body with long-term disease. Excuse me. So if you have a patient who has an issue with who had a long chronic disease, the pulse would be floating and powerless. Okay. So this is how the floating pulse should look like. As you can see, um, very, very light pressure. You can already feel the pulse. And as you press deeper, the pulse disappears. Okay. So as mentioned earlier, this is found also, yeah, it's both exterior and deficient conditions, and also on those people who have been sick for a long time. So it's floating and powerless. So in exterior conditions, this quality indicates the presence of an exterior pattern from invasion by exterior pathogenic factor, which can be wind cold or wind heat. So it's usually accompanied by wind. So wind cold or wind heat. If it is floating and tight, it is wind cold. If it is floating and rapid, it is wind heat. Okay. So floating and tight, wind cold. Floating and rapid, it is wind heat. In interior conditions, if the pulse is floating at the superficial level but empty at the deep level, it indicates yin deficiency. So there. So if you have patients with interior issues, you can feel the pulse floating at the superficial level, but it is empty at the deep level. So that means it is yin deficiency. In rare cases, the pulse can be floating in other interior conditions like anemia or cancer. So this is quite rare. In these cases, the pulse is floating because Qi is very deficient and it floats to the surface of the body. So take note, anemia or cancer. So to summarize, the clinical significance of floating pulse includes invasion of external wind, yin deficiency, which are interior conditions, organ disease, interior conditions, and stomach prolapse, interior conditions. So let's do some pulse comparisons. If the floating pulse is bigger than normal, so you already understand what we mean by bigger, but without the substance in its center, when slightly more pressure is applied, it is called a hollow pulse. No? Okay. A floating pulse with strong beats is flooding pulse. Under light pressure, this pulse feels strong as it rises, but slow and weak as it falls. A floating pulse with slow or leisurely beats, which feels bigger than normal but lacks strength, is called empty pulse. So I guess that's easy. hollow, flooding, empty. So they are different from uh, the floating pulse that we are talking about now. A floating pulse, which is spongy, weak, and thin, is called a soft pulse. A floating pulse, which is without root, coming and going without distinct form, is called scattered pulse. Okay, so let's now go to the most favorite part of the topic, which is assessment. Let's call on Doc She. Good evening.
Hi, Doc. Good evening.
Yes. I wouldn't mind if you can answer this, pero I'm sure you can answer this easily. So, if you have a soft pulse, what does it indicate? Malambot na pulse in Tagalog.
Is it still related to the floating pulse, Doc?
No,
No na.
no na. Kasi very
No
easy
na
lang
siya.
naman yung floating. We will
Mm-mm.
ask it some other time.
Soft pulse indicates deficiency
Yes, because it's soft.
yeah,
Deficiency of what?
of blood.
Yeah, deficiency of blood, yin, deficiency of qi. What else? Okay, so we have the result of spleen deficiency, which is dampness. Diba? Mm. So you can have soft pulse in dampness. Okay? So dampness or deficiency of qi, blood, and yin. Next, what about weak pulse? Kanina it was soft. This time it's weak
Weak.
pulse. Yeah.
So pag weak siya, it is chi.
Yeah.
No
Qi.
chi deficiency, Doc.
Yeah. Qi deficiency and blood deficiency.
Deficiency.
Diba? Qi and blood, they always like qi is the commander, blood is the mother. Hollow pulse. I think I mentioned this earlier.
Yeah, it's like a floating pulse but with bigger than the normal pulse.
Yeah, when you go to the middle pulse, it's hollow.
Hello.
It's like
Nawawala.
so that means what does it indicate?
Hindi,
Kasi when
it
you go to the
indicates,
middle level, nawala siya.
yeah. So indicates more on chronic diseases, doc, or
Yes.
long-term diseases na siya.
So what do you think? Like when we feel the middle level, we're actually determining the flow of blood, right?
Yes.
So if that um level is you can't feel the pulse, so what does it mean? Kasi wala no? Hollow.
Mm-mm.
Walang laman. You said kanina, loss of, yeah, you can have loss of blood or deficiency.
Lost. Okay. Parang, okay.
Mhm. So that means if you're able to treat the patient, mag-iba yung pulse, 'di ba? Kasi pulse is more current, more uh, in the moment. Number 4, leather pulse. Ay nako, if you
Yung
can
nabanggit
put
ko
it on your
kanina.
patient, you will never forget it.
Mm-mm. Siguro, doc, na-experience ko na in one way or another. Pero I'm not
Mhm.
yet too much particular talaga kasi yung sa patient ko kasi ang differentiation ko lang talaga ng
Mhm.
pulse is deficiency at saka yung excess. Doon lang muna ako nag-ano kasi medyo nakukonfuse na ako pag marami ng
Mhm.
paiba-iba kasi may patient talaga halos iba-iba lahat eh.
Mhm. I actually felt this sa isang 74-year-old man, a war veteran from from Vietnam, American. Ay, grabe. Leather na leather talaga. So the cause could be essence exhaustion, or if you have a patient who lost a lot of blood, there can be leather pulse as well. Or
So
abortion.
anong so anong distinction niya, doc, yung leather pulse na yan?
Parang siyang drum skin. Pero superficial siya.
All three positions, though.
Yes. No,
Oh.
superficial. Mostly superficial. Pero pag diniin mo, nawawala na yung pagka-leather. Para bang like drum skin. Yeah.
Hmm.
Next,
Hmm.
Scattered pulse. I think I explained this earlier.
Hindi ko masyado nakuha kanina doon.
Okay, it means your chi is exhausted. There is organ failure. No? Scattered. Scattered na. So, parang kalat. No? Naubos yung chi. Hidden pulse. Nagtatago.
So
Nagtatago
that,
sa ito.
oo. So that's pag more on parang empty or
Yeah.
exterior.
Pathogens are obstructing the interior. Parang tinago siya. Kaya mafe-feel mo siya sa ano. So it means maraming pathogens sa loob or may syncope. No? Next, firm pulse. Firm, matibay. What does it indicate?
Ano yun
Will
siya?
it mean cold or heat? Firm, para siyang tight din. Para mas matigas doon.
So that's cold.
Yeah. Interior, excess cold. Katulad ng pag may hernia, may mga lumps, masses. I don't know if, okay, kaya nga you have to be very, very, you have to be very sensitive. Huwag magmadali magpulso. Ideally, it should take you between 2 and 3 minutes to be able to really thoroughly feel the pulses. Okay? Minute pulse, kapipiranggot na pulse. So it's obviously very obvious. It's all very obvious. Obviously, very obvious. It's very, very obvious. Ano ba tong grammar ko? So, anong minute pulse? It's definitely deficiency, diba? So deficiency of
the blood,
chi, yin, and
yin,
yang. Everything. Kasi minute
lahat.
lang, maliit lang. May mga ganon. So you have to really, really qualify. Ano ba siya? Chi deficiency, blood deficiency. Of course, you know the difference between yin and yang deficiency. Wiry pulse. Ay nako, this is very common, especially for people who are under a lot of emotional stress.
Wiry. Yan yung may liver, gallbladder disease.
Yes, and also those who are in pain. No?
Pain.
At saka may, actually, pag marami kang phlegm, your pulse can also be wiry because phlegm can obstruct the flow or malaria. And finally, tense pulse.
So that's, excess pulse.
Yes. Like, ano yan? Hot or cold?
Hot.
No, tense yan. Tense. Tight.
Oh, tight. Cold. Cold.
May pain din. Kasi
Excess cold.
actually, napakasakit pag due to cold ang pain. And also retention or stagnation of food. So thank you very much, everyone, for joining. Hope to see you again next week.
Thank you.